Around the world, millions face threat to their right to health. Diseases, disasters, conflicts and pollution are endangering lives and well-being. According to the WHO Council on Economics of Health for All, despite health being recognized as human rights by 140 countries, over half of the world's population lacks full access to essential health services.
The National Health Insurance Act was signed into law in 2022, and this is supposed to see a higher uptake of service at the point of care in hospitals and also getting more people on board of the National Health Insurance Scheme. As I speak today, we have about 3% of the Nigerian population on the health insurance scheme, and these are basically employer-generated health insurance, of which we have about 1.9% of that 3% being men and 1.1% being women. This is very little, and this needs to be worked on.
The statistics of last year wasn't very, very favorable to us in this country and beyond, because many people were missed universal health coverage. Many people missed had lack of water, lack of health care in different places in this country.
We rank poorly amongst not just Committee of Nations, but even our neighbors in sub-Saharan Africa when it comes to health indicators, especially when you look at the maternal under 5 neonatal mortality rates.
To address these challenges, World Health Day 2024 has been themed My Health, My Right. It champions universal access to quality health services, education, clean water and more. Regardless of economic conditions, access to basic health services should be for everyone.
In keeping with our mandate, which is the government's attempt to ensure that most Nigerians have health insurance coverage, and that protects them from the catastrophic costs of healthcare and also enhances financial access to healthcare.
Our job is to critically put in place legislative policies, guidelines to ensure that we can implement regulatory frameworks. At the same time, we have to be a government that is enabling the private sector, because the private sector is by far the largest provider of healthcare.
Recent progress notwithstanding, the Nigerian healthcare sector grapples with persistent challenges such as outbound medical tourism, deteriorating infrastructure, insufficient government funding, and the exodus of skilled healthcare professionals due to inadequate compensation.
I believe going forward this year, there must be priority on the right of universal healthcare coverage for every Nigerian in this country. I'm glad that we now have Nigerian Health Insurance Authority that is mandatory for everybody living in this country.
As Nigeria joins the rest of the world in commemorating this year's World Health Day, it is important to underscore that health is not just a privilege, but a fundamental human right. It plays a pivotal role in shaping education, economic prospects, poverty alleviation, and sustainable progress.
Healthcare is a fundamental human right, and creating that access is one of the best things that can happen for people to be able to get adequate healthcare, particularly when they need it.
Every Nigerian, every African needs and have right for health. And I believe that going forward, our country will be part of those bringing valuable healthcare to the community and everybody in this country.
When people come to ask for our votes, let's not just focus on the number of roads they will construct. That's very important. What they will do to power, extremely important. But also, how are they going to make sure that all our primary healthcare centers, secondary and tertiary healthcare centers are functional and have the right staff? How are they going to ensure that before they leave, they reduce our mothers and children who are dying unnecessarily?
Through collaborative effort among all stakeholders, including the private sector, Nigeria can pioneer innovative solutions tailored to the diverse needs of individuals, families, communities, and nations alike.